Good evening. So I want to welcome everyone to one of my informational videos, and this is really a good insight into how I practice and what kind of work I do, and I'd like to make it more clear for people that are interested in seeing me.
Okay. Can you describe a little bit about your practice and what it is that you do and the kinds of offerings that you have for people?
Sure. I have a very integrative practice, and I use in my practice simultaneously Western medicine as a nurse, acupuncture and herbs as a Chinese medical practitioner, homeopathy. I use nutrition and lab tests, and it's really known as functional medicine now. It's not one field, and or integrative medicine.
So it's similar to integrative medicine.
It is really a form of integrative medicine.
It is. Okay.
And it's an integration of all these different fields which I'm trained in and I practice and have for many years.
What are your what are the main health issues that people come to you? I noticed that you've listed 10, but I'm sure there are more than 10, you know, some of the big ones. Can you just describe some of the main health issues?
I mean, I always use 10 because people like to hear 10s, you know, but really, one of the main reasons people come to see me for is issues with their thyroid. A lot of people, especially women, have problems and they're not getting diagnosed or treated correctly by their primary care physicians. And they wind up coming to see me, they're totally frustrated. And they have, you know, they feel cold, their hair is falling out, they gain weight, they can't lose weight, they're depressed, they're constipated. And they just can't seem to get these symptoms to go away. So this is one of the things that a lot of my patients come, and many of them have Hashimoto's, which is an autoimmune thyroid. And either they don't know it or they do know it, and they're not getting it handled very well.
I've heard somebody talk about brain fog. What is brain fog? I know that you've listed that in the past.
It's a sense that your brain isn't working very well, like you're in a fog. You can't think clearly, you can't remember things, you know, you're just not sharp. And a lot of times it's accompanied by fatigue. A lot of times it's thyroid, other things cause it. Adrenal function, low adrenal function can cause brain fog. Low blood sugar causes brain fog. Allergies can cause it, infections can cause it. But it's a very common symptom, and someone who's not that old, it's not like a 90-year-old person, just they know they're not able to think clearly, and so it's called brain fog, but it's very common.
I know on your website you have an article about Lyme disease. Do you see a lot of people with Lyme disease, or do they not even know they have Lyme disease?
Well, both.
Yeah.
I do see a lot of people with Lyme disease, just like with their thyroid, they're not getting good results. They're struggling, they're not getting better. It's a very complex and very difficult condition to deal with. And some people don't even know they have it. A lot of people don't know they have it. They've been diagnosed with something like fibromyalgia.
Right.
And the truth is they really have Lyme disease, but no one's ever picked it up.
Yeah.
It's difficult to diagnose. Blood tests aren't very good for it. So yeah, I see a lot of people with Lyme disease, and many of them have other conditions as well. And they don't know what they have. They just know they're not doing well, they're not getting better, and they want somebody that can help them feel better or recover. So yeah, I get a lot of people with Lyme disease.
You've been in practice a pretty long time. What do you feel are the main causes of these health issues?
Well, I want to go back to one thing first. I want to talk about some more things that I treat.
Okay.
Because there's some other things that I do that I know a lot of people have problems with. I see a lot of people that are struggling with depression and anxiety. And these are not always people that have emotional problems. But they still feel depressed or anxious. And a lot of them are due to allergies, thyroid issues, food problems, infections, Lyme disease. And you just can't treat people that have those problems with antidepressants or anti-anxiety medication. It's not enough. It doesn't get down to what's driving it or what's causing it. And so that's another one. But also I get a lot of women that come to see me for menopause symptoms. They have hot flashes and night sweats and racing heart and insomnia and weight gain and depression ever since their hormone levels dropped, and they are also not getting any relief anywhere. And and they're afraid to take hormones. With good reason, because they can be pretty scary and risky. And I also get a lot of people with indigestion, acid reflux, gas, bloating. You know, they just can't seem to ever eat a meal without feeling uncomfortable and miserable. And they get headaches. I mean, the whole idea of eating a meal is a challenge for them. And the last big category that people see me for is insomnia. A lot of people can't fall asleep or stay asleep, and they don't know what to do about it. And a lot of these things are interrelated. I mean, they're not like in separate categories. It's just the patient, and they have some variety of these problems. And so my way of working seems to address
A lot of
these issues all at the same time.
Great.
So as far as the causes go, the question as to what causes these
Right.
things, well, I would say one of the main causes of people's health issues these days is chronic inflammation. And chronic inflammation is becoming more commonplace. Some of it comes from food allergies, some of it comes from infections, some of it comes from medication that people are taking for other purposes. But whatever is causing it, it's common, and the drugs that people are taking for it are making them even worse. I mean, taking steroids does make you feel less inflamed, causes its own problems. It doesn't correct it. Chronic inflammation is a real growing issue.
How about high blood sugar? Can you talk a little bit about blood sugar, liver?
Blood sugar is high blood sugar is a precursor to diabetes. A lot of people are not normal and they're not diabetic, but it's high. And it's a very inflammatory condition. It causes people to gain weight. It causes inflammation, and to be worse, it's another reason why people have inflammation. And a lot of it comes from eating habits they don't realize are unhealthy. People don't eat breakfast, they eat allergic foods, they don't get any protein, they can't digest protein. Other health issues they have cause high blood sugar. High blood sugar causes other problems that they don't even realize are connected to high blood sugar, like cysts and fibroids. So high blood sugar is becoming an epidemic.
Tell me more about injuries, emotional stress, autoimmunes. You've listed some of these health issues that, how do they manifest themselves that you see with people?
A lot of these are conditions that people see me because they're not responding to other treatment. That's why they come and see me. They usually go to the doctors first, and the doctors can't seem to get some of these conditions to improve, so they wind up seeing people like me, and they see me. So injuries, a lot of times you have an injury, and you're never the same. It's like, you had an accident, a car accident, and then you're never the same. And it leads to many other problems. Plus, they're still in pain. Very often they're still in pain, and no one's ever gotten them out of pain. They still have now chronic inflammation where the injury was, and they can't seem to get that to subside. So, injuries don't always heal.
Right.
And autoimmune diseases is a growing epidemic. There's now more autoimmune diseases diagnosed every year than all of cancer and heart disease. Some of them are very mild and very minor, and some of them are very serious. But they're not easy to treat. It does require a multifaceted approach, and people have to learn what causes them to get worse and how to get them better. And it requires a lot of functional improvement. But Hashimoto's, for example, is autoimmune thyroid. There's psoriasis. There's autoimmune diabetes. Rheumatoid arthritis is an autoimmune condition. Lupus, multiple sclerosis. There's a lot of them. And I think the exposure to all the toxic substances that people are exposed to these days, all the chemicals, all the hormones, all the things that are hormone disruptors in our food and our day-to-day products that we use, is taking its toll. And I think people's immune system is reeling right now. As far as emotional stress goes, emotional stress is a very widespread and common problem, and people don't know often how to manage it. Emotional stress just makes you, it's another reason why people feel inflammation. It causes inflammation. And it's something that people have to learn to manage. But some of these other things reduce emotional stress. I mean, if you have Lyme disease and you are not getting better, you're going to feel emotional stress, as well as have the Lyme disease. If you can't sleep, you're going to feel emotional stress just because you're tired all the time. If you have injuries that don't get better, if you're in pain all the time. But it's not just that simple. A lot of people have emotional stress because their family members have these problems. I mean, there isn't a mother walking around who's got a child with Lyme disease that doesn't feel emotional stress.
Right.
Or if their child has autism, or if their child has indigestion and allergies, or can't breathe, or can't go to school and function. It's stressful for the whole family. So the health issues themselves cause their own stress, and stress makes them worse. And I do work with it, although it's not the primary thing I do. I always address it somehow, try and get some balance in their life.
Is there a tool that that you use that can help assess some of these situations we've been talking about?
Yes. I've developed something called the Metabolic Assessment. And it's a tool, and it's also a seminar I do. And what it is, the actual assessment is a questionnaire.
Uh-huh.
And it has lots and lots of questions, and they're organized in functional categories. And people just answer them. And then when they're finished, they don't really know what the categories are. I don't want them to know. And then when they're finished doing the answers to all the questions, I go over the categories, and then I tell them what causes the symptoms they're having in these categories. But nobody knows what they answered. It's very confidential. I can do it in a group of 30 people. No one knows what each person answered. But when I go over the causes of their symptoms, they begin to see what it's related to, what it's connected to. And so they get some insight. Number one, that some of the things that they didn't realize were related are related. I mean, if someone has hemorrhoids and their eyes are not very good, and they're having headaches and menstrual issues, menstrual irregularities, that might all be related to liver function. But they would not have connected it.
Right.
Of course, their primary care physician would have never talked about it that way, but I do. And so in my metabolic assessment, I group a lot of symptoms together in functional categories, and I give people a chance to understand some of what's going on. Now,
So it's like there seems to be patterns then. Is that something you're looking for
yes,
when you're looking at
I'm always looking for patterns. Patterns of disharmony, patterns of imbalance. And they're functional imbalances. And I'm always trying to see, well, is there a functional imbalance? If so, what is it? So they cover a lot of territory, but this metabolic assessment is not just a tool, it's also a talk I do. It's one of the best ways for people to see what I do and to get clear about their own health issues and maybe what they need to do about them.
So where's the assessment? Is it on the website? Is it something that you bring?
It's
How do you get the assessment?
They come to the seminar.
Okay.
They hand it out, they fill it out, it's confidential, they go home with it, they don't have to discuss it, they don't have to see me, they can see me, but it gives them an opportunity. It's the best way people can find out what kind of work I do and what their health status is. This is like when you get a home inspection on your house,
Right.
and you find out all kinds of things you didn't know were there. Because who looks at their heat, the heat exchanger in their furnace, and who looks in the attic to see if their roof is leaking. But when you have a home inspection, all these little problems are noticed. Well, when you do a metabolic assessment, all kinds of things about yourself become clearer and more understandable. And then you can do something about it. You can get a blood test. You can see me for a consult. You can do some work on improving your diet, or you can work on some aspect of your health that you didn't realize was even something you could work on before. That's related to your symptoms that you didn't realize was related to your symptoms.
You spoke about your seminar. How does the seminar work? Can you tell us a little bit about, can people hire you to do a seminar? Where do they find out about the seminars that you're doing?
Well, I have them in my office, and also I have some people that arrange them for me.
Okay.
In different places. And so if they'll be, I will schedule all the metabolic assessment seminars that I'm going to be doing in the next 2 months on my website, so they can see where they are and when they are.
Okay.
And if they want to attend one, they can attend one, and then they can find out for themselves what this is like. And it is the best way for people to find out what I do and how I can help them.
How long is the seminar?
2 hours.
2 hours. What does the Metabolic Questionnaire assessment cover?
Well, we go over, I'll give you a ballpark.
Okay.
Blood sugar issues, liver function, gallbladder function, large intestine function, small intestine function, brain health, hormone balance, thyroid function, adrenal function. That's a lot of territory right there.
That's complete home inspection. Like you said, that's a home inspection.
It covers
of the
a
body.
lot of territory. And when you walk out of it, you can begin to see where you need to do some work, whether it's with me or not. It's very, very informative and enlightening for many people.
Once you begin to understand what one of your patients needs, how do you go about providing a restorative way of life for them?
Well, if they'll meet with me and do some work, we'll get a comprehensive blood test. We'll do food allergy testing. And I'll also delve into everything I can figure out about where there's functional imbalances. Once I identify them, after all that, I'll begin to make recommendations about how they can change their diet, which is almost always necessary. If they have infections, which many people have, I'll begin to find some recommended remedies, homeopathic remedies usually, for viral infections, fungal infections, bacterial infections, parasites. If they have blood sugar issues, they need some coaching about how to eat and how to get their blood sugar down through their own diet. If it's their liver or their gallbladder, which is very common these days, there's nutritional remedies, there's herbal remedies that will support their liver function. We can do some acupuncture, sometimes that's needed, especially if there's pain. I'll make recommendations that I have used over and over the years that have success. I mean, some of the things I do all the time, I get people's cholesterol way down when it's up. And a lot of times I can get them to reduce the amount of medication they're taking, or find alternative substances that aren't as many side effects. I can recommend some lifestyle changes, give them some support in how to manage their emotional stress. So it's a variety of things, but it's that kind of work. It's all aimed on functional balance.
So you're really treating the whole person.
Whole person.
Just a whole way of life, a whole complete way of working with somebody.
Yes. Okay. But it's really aimed at functional improvement, not symptom eradication. Even though symptom eradication does happen, it's because of functional improvement of all the body systems and the organs and gland functions.
There are some stubborn conditions. Can you talk a little bit about them? Lyme disease, arthritis, irritable bowel, how do you say that?
Fibromyalgia.
Fibromyalgia. Gosh, what a word. Can you tell me a little bit about that?
Those conditions are usually complex, and there's more than one thing going on. So if someone says they have fibromyalgia, what I usually find is they have quite a few infections, and they have allergies, and they have blood sugar problems, and they have liver toxicity. I mean, they have a lot of things. There's no such thing as fibromyalgia in a way. Fibromyalgia is just a name given to probably 10, 15, 18 different small or big imbalances with a variety of problems. And many of these so-called complex conditions are like that. They have an original cause, but they progress. A lot of people with Lyme disease also have autoimmune conditions. People with rheumatoid arthritis very often have Lyme disease undiagnosed. And so these are the reason these are stubborn conditions is because no one's looking at all of the different aspects of their breakdowns. These are not one thing. And that's why they're stubborn, because they're being treated like it's one thing when it's often 5, 10, 15, 20 different things that need to be addressed over a period of time. And they respond very well to what I do.
How do people find out about your metabolic assessment seminar? Where is it posted on the website?
My website has a calendar of upcoming seminars, and that really is the best place to go.
Okay.
And if they go there and they see them, or they can just contact me, just send me an email or send me a text and say, I'm interested in going to one of these, when can I do one?
Okay.
If they don't want to go to a seminar, they can just come to me and make an appointment. But if
They
they
can
want
find
to,
your email and phone number on the website, I
Yes.
assume, of course.
yes. And that really is the best way
Yeah.
to do this. And it's inexpensive, not very much time, and a great educational experience.
Do you lead any other seminars that somebody could go to?
I do, not as often as this one, because this is the best one, but I do a whole seminar on the thyroid, because it's that complex, and so many people have problems with it. I periodically do a seminar on menopause and the issues around it, and I'm going to start doing a talk this year on brain health and aging,
Okay.
which is really an extension of what I'm doing now.
Awesome. Well, thanks so much. I'm always interested to see what you do, and certainly have been a patient of yours, and you have changed my life in the work. Having cancer last year and seeing you weekly was an amazing journey, and something that I'll never forget, and something that really helped me out tremendously. Thank you.
Thank